If you're over 60, you could be making a stroke mistake every single day and feeling completely fine while you do it. No headache, no weakness, no warning. And that's exactly why it's so easy to ignore. Because the dangerous part isn't always the symptom you can feel. Sometimes it's the number you never check. And if you click this video thinking, I feel fine, so my stroke risk must be fine too, there's something important you need to know. You can feel completely normal, while one of the biggest controllable stroke risks is quietly working against you. It's your blood pressure. And here's the first thing I want you to remember. High blood pressure is the leading controllable risk factor for stroke. The problem is that high blood pressure usually doesn't announce itself. You don't necessarily feel pressure in your head. You don't necessarily get dizzy. You don't necessarily get a headache. In fact, measuring your blood pressure is the only way to know whether it's high. So if you only pay attention to how you feel, you could be missing the very thing you need to know. But don't start checking your blood pressure once and assume you're done, because that creates another mistake many people make. One reading is only a snapshot. Imagine checking your blood pressure one morning and seeing a number that looks perfectly fine. You feel reassured. But what happens tomorrow, or next week, or during a stressful afternoon, or when your medication timing changes? Your blood pressure can change throughout the day, which is why a pattern of readings can tell you much more than a single number. That's why keeping track of your readings and discussing them with your healthcare professional can be so useful. And there is another important detail here. If you're already taking blood pressure medication, don't make the mistake of deciding to stop taking it simply because your numbers look better or because you feel perfectly healthy. Those better numbers may be a sign that the treatment is working. Your healthcare professional, not your symptoms, should guide changes to your medication. But here's where this gets even more interesting. You can take your blood pressure seriously and still have another important stroke risk hiding in plain sight. And this one has nothing to do with what you ate for breakfast. It's your heart rhythm, specifically atrial fibrillation, often called AFib. AFib is an irregular heart rhythm that can increase the risk of blood clots and stroke. And the tricky part? Some people with AFib have obvious symptoms. Others may have symptoms that are mild. And some may not notice anything at all. So you could be thinking, my blood pressure is under control. I'm exercising. I feel good. And yet there could still be another risk factor worth discussing with your healthcare professional. That's why, especially as you get older, regular medical checkups aren't just about treating problems after they appear. They're also about finding risks before they become emergencies. And this is where the bigger lesson of this entire video starts to come together. You don't need to become obsessed with your health. You just need to stop relying on symptoms to tell you whether your stroke risk is under control, because symptoms are not a reliable blood pressure monitor, and feeling normal is not the same thing as having normal blood pressure. So what should you actually do? Don't guess. Measure. If you have a home blood pressure monitor, use it according to the instructions and keep a record of your readings. Your healthcare professional can help you understand what those numbers mean for you and whether your treatment needs to change. And don't ignore the other controllable risk factors either. Work with your healthcare professional to manage the risks you can control, such as blood pressure, cholesterol, diabetes, AFib, smoking, physical activity, and diet. You don't have to fix everything overnight. The goal is to know what you're dealing with. But now, I want you to remember one number. Not because you should obsess over it, but because there is a situation where a blood pressure reading can become an urgent warning. That number is 180/120. If your blood pressure is higher than 180 systolic and slash or higher than 120 diastolic, wait at least 1 minute and check it again. If the second reading is still that high, you should contact your healthcare professional promptly. But there is an important distinction you need to know. If your blood pressure is above 180 over 120, and you're experiencing symptoms such as chest pain, shortness of breath, back pain, numbness, weakness, vision changes, or difficulty speaking, that can be a hypertensive emergency. Call 911 immediately. Don't sit there waiting to see if it comes down. Don't convince yourself that you'll check again tomorrow, and don't assume that because you've had high numbers before, this particular reading doesn't matter. Those symptoms combined with the reading above 180 over 120 require urgent attention. But there's something even more important I want you to understand. Everything we've talked about so far is about lowering your risk before a stroke happens. But what if prevention is no longer the question? What if the stroke is happening right now? That's when you need to recognize BE fast. B is for balance. A sudden loss of balance or coordination, trouble walking, or sudden dizziness can be a warning sign. E is for eyes. Sudden vision changes. Blurred vision, double vision, or loss of vision can be a warning sign. F is for face. Ask the person to smile. Does one side of the face droop? Does the smile look uneven? A is for arms. Ask the person to raise both arms. Is one arm suddenly weak or numb? Does one arm drift downward? S is for speech. Is their speech suddenly slurred? Are they having trouble speaking or understanding? Ask them to repeat a simple sentence. If their speech is suddenly abnormal, don't wait. And finally, T is for time. Time to call 911. Because a stroke is a medical emergency, and every minute matters. Even if the symptoms seem to improve or disappear, don't simply assume everything is fine. Get emergency medical help, and remember the bigger picture. The reason I started this video by talking about feeling normal is because that's where the mistake can begin. You wake up, you eat breakfast, you take your medication, you go for a walk. You talk to your family, you feel completely normal, and your brain naturally tells you everything must be okay. But your body doesn't always work that way. Some important stroke risks can exist without giving you an obvious warning. That's why knowing your numbers matters, knowing your blood pressure matters, knowing your medications matters, and knowing the warning signs of a stroke matters. You don't need to live in fear of a stroke. You need to be prepared for one. So if you're over 60, here's the simple action I want you to take after this video. Don't ask yourself, do I feel sick? Ask yourself, do I actually know my numbers? Know your blood pressure. Keep track of it. Take prescribed medication as directed. Talk with your healthcare professional about your individual stroke risks. And remember, BE fast. Because if a stroke ever does happen, recognizing it quickly could make a critical difference. Feeling fine is good, but knowing your numbers is better. Because sometimes the most important warning sign isn't something you feel, it's something you measure.